So if cutting Medicaid was wrong when he was a candidate, why is it right in the new Republican Senate bill?
I don't believe that the president has specifically weighed in that it's right to cut Medicaid.
Does the president still believe, as he did as a candidate, that there should be no cuts to Medicaid?
I haven't had a specific conversation to see if there is an update to that, but I do know that he wants to protect that as much as possible.
There is this line that you're hearing when you talk to Republicans about this bill. Got to pass it because what they promised to do is repeal and replace Obamacare. They got to keep their promise. They made a promise to people, and you heard it when you played Trump there, but also Mitch McConnell and Paul Ryan and all the others. They understood what people didn't like about Obamacare. They didn't like that it left a lot of people uncovered. Mitch McConnell on Face the Nation said it left 25 million people uncovered, and he's right. They didn't like the deductibles were so high, premiums were too high, co-pays were too high. People ended up in insurance they couldn't afford to use. So they told people they would repeal and replace Obamacare with something that fixed these problems. Right. And this makes every single one of those problems worse, every single one. Higher deductibles, higher premiums on an apples-to-apples comparison for insurance, higher copays, fewer people covered. You are supposed to be able to trust that people basically want to go in the direction they told you. Maybe they exaggerate. Maybe they're saying it's going to do more than they say. Well, but the basic direction. But that's not what this is at all. They said they would go one way, and they're going the exact opposite way.
Paul Ryan said this thing. I want to play this for you because, to me, this is such a tell about what the agenda is here when you're talking about what they said they would do and what they're actually doing. Take a listen to this.
So Medicaid, sending it back to the states, capping its growth rate. We've been dreaming of this since I've been around, since you and I were drinking at a keg. You know.
I was thinking about something else. He was thinking about reforming Medicaid.
I was. I've been thinking about this for a long time.
I mean, to me, that shows you in some ways what this is really about, which has nothing to do with the ACA.
Yeah, there is a consistent vision everywhere in this bill. And basically what it is that poor people should pay more for less care. And I heard Ovick before, and Ovick's a friend of mine, but a lot was getting elided in that particular discussion. There are states that have refused to expand Medicaid by choice because they don't want poor people to have that health insurance. If they expanded Medicaid, those folks would get better health insurance. Now, if you move all the people who could get Medicaid onto these private plans, and particularly onto the much cheaper plans this bill is envisioning, what they get is health insurance that is much worse. They have to pay quite a bit more for. On page 5 of the bill, there is this piece that people are not going to report that much on because it's complicated, but it's really important. What it does is the Affordable Care Act ties subsidies to health insurance plans that cover 70% of your costs. This bill moves that down to 58%. A plan that covers 58% of your costs, you're looking at about a $7,000 deductible. So that, if you wanted to just encapsulate the plan in one move, it is that you move from health insurance that actually covers things to health insurance with about a $7,000 or more deductible. And subsidies, that is all you can get it for. It's a really, really profound change.
And that what's key there is that the insurance companies have basically sat on the sidelines. They've been essentially ostensibly publicly neutral on this. And part of what's insidious, I think, about this, which you're pointing to, is this sort of shoves a lot of money towards the insurance companies to sort of keep them neutral, as I understand the structure.
Oh, and it's worse than that. So if you look at the Affordable Care Act, the way they keep insurance markets stable is the individual mandate. They try to pull healthy people into the insurance markets. In this iteration of the bill, there is nothing that even replaces the individual mandate, right? They zero out the individual mandate. The House bill had something called continuous coverage. Probably wouldn't have worked, but at least was a shot at replacing it. This has nothing. And so I asked people, how are you going to keep insurance markets stable? And they've got this multi-$100 billion fund that they're just going to hand insurers money. You heard some Republicans calling it an insurance bailout. It's not a bailout. It's a payoff. It's a payoff for participating in the markets and not fleeing them.